Good morning, everyone. My name is Travis Parsons. I'm the Associate Director of Occupational Safety and Health at the Labor's Health and Safety Fund of North America. Thank you for joining us today on our second vodcast of a series of vodcasts coming in the future. Today, we're going to talk about the emergency temporary standards for COVID-19 that are being enacted across the country. I believe there's 4 states now, and there's probably more to come. We're lucky to have MK Fletcher here from the AFL-CIO. She's a safety and health specialist at the AFL-CIO. I'd like to introduce MK and let her say a little bit about herself. Go ahead, MK.
Thanks, Travis. I'm happy to be here and talk to all you guys. So I'm MK Fletcher. I'm the safety and health specialist at the AFL-CIO, and I've been working with our affiliates and with these various states to help get some emergency temporary standards in place, or otherwise some type of worker protections in states, as well as the federal efforts that we've been taking on to try to get some worker protections.
Okay, thank you, MK. So today we're going to have a conversation about something that's going on in everybody's mind, COVID-19. We're under attack here by this pandemic, I should say, and we're going to try to sort through some of the emergency temporary standards that are at the individual state levels. As you may or may not know, we don't have a federal level emergency temporary standard from federal OSHA right now, and therefore state OSHA programs are having to step up through their governors and through their state OSHA programs to protect workers on our work sites. Now, while we're very happy about some of these states stepping up and protecting the workers in the individual states, it can get a bit confusing when it comes to contractor compliance and worker protections, especially when you work across different state borders. For contractors, what do I got to do in one state versus another? It can get very confusing. And for workers, when it comes to their own protection, what do they got to do? How do they comply with the rules? So this can be very confusing when there's not a consistent message from the top. Virginia OSHA was the first one to set the standard back in, I believe it was July. They passed the standard, went into effect in July 27th. They actually passed it on the 15th. So 2 weeks later, it went into effect. And they really came out with a strong standard. And the next state to come up with a standard of their own was Michigan in October. I believe it was October 15th. They enacted their standard. Then not too long after that, Oregon followed. And then finally, just last night, Cal OSHA passed their emergency temporary standard. So we have 4 states now with emergency temporary standards that people can follow to protect their workers and out from COVID-19. Other things that are going on are individual governor mandates. So governors across the country are doing executive orders or having mandates or allowing their public health departments or their OSHA programs to enforce guidelines from CDC and or their mandates. Some highlights of some some highlights of some states that we know that are doing that in particular are Kentucky, Minnesota, Washington State, and New Jersey. And in particular, New Jersey has some added protections for their public employees, which is a good thing. Now, we're going to jump right in here and talk about some of these details of these individual standards. And we're going to try to do some highlights of the state ETS, the 4 that we've talked about. I'll start off by talking about Virginia. The Virginia ETS, I'm happy to say that I currently serve on what's known as the Virginia Safety and Health Codes Board. I've been a member of that board for 6 years, and it was a pleasure to work on the COVID-19 emergency temporary standard, the first in the country to set the tone and set the bar. This standard applies to all workers under what's called DOLI, which is basically all workers in Virginia that are covered under their OSHA program. It's a really strong standard. It focuses on a risk assessment, categorizing workers into different risk levels. It's got a written plan requirement. It has a lot of really good parts to it. It follows what we know in our health and safety world as the hierarchy of controls, which we'll talk a little bit more about later. I feel it's very comprehensive and relies on good, sound science for worker protection. I will say, I'll just give you a little personal testimonial. It was 4 long days of several amendments and deliberations to get it done, but we got it done in Virginia, and we're proud of that standard to being the first one. It does require employers to classify their employees in different risk levels, It establishes and implements a system for self-assessment and screening of workers going on and off the work sites based on signs and symptoms. It requires implementation of infection control procedures. And also, one thing unique to it is it does establish return to work policy. And one thing I would like to finish talking about Virginia with, and then I'll let MK jump in here, is there were some things that we got major improvements during the process, during the amendments and deliberations. And one of those was worker training. The first draft of this standard, I believe, had some, good worker training requirements, but it wasn't as prescriptive and detailed. And through a lot of effort by our allies and labor, we got a lot of good worker training protections and prescriptive elements in there in the end. And there was also some exemptions that were in the original draft that we kind of got taken out. The exemptions would have exempted people if they just complied with CDC guidelines. And as I mentioned earlier, guidelines are guidelines, not rules. And they also exempted some other specific areas of the state, which we believed all workers should be protected. So we got those exemptions out. We're very proud of that. Now, MK, I'd like to ask you, would you like to add anything about the Virginia standard?
Yeah, I'd like to reiterate, I think, the state started out with a strong framework for a standard and really commend the board for making improvements upon that to ensure that Virginia workers are actually protected. You really expanded the good framework that the state set up to ensure that workers who are working where outbreaks are currently happening are getting the most protections. And are getting those trainings, or have the appropriate controls in place. That was really great. And then, you mentioned the exception language that was altered in the Virginia one when it came to CDC guidelines. And that's important not only because the CDC guidelines are only guidelines and not enforceable, but they change so frequently. It's really hard for me as a public health professional, but much less employers and workers, to know what all these guidelines are that are constantly changing. And there are hundreds of different CDC guidelines, which ones apply to their industry and which don't, when the OSHA standard is really like, here is what you do. This is how workers can be protected.
Yeah, thank you. And that'll set the tone for our discussion here all the way to the end about the basis of what we're doing here with the emergency temporary standards. The next one I'd like to talk about is the Michigan ETS rule that went into place not long after that, recently here, not long after Virginia. The standard does apply to all workers in Michigan. They focus on a good risk assessment plan, just like Virginia. It has some basic training requirements. It is kind of went in tandem with some of those executive orders that Michigan came out with early in this pandemic. And it also has some additional requirements for healthcare workers, which are some of the very frontline workers that are under really siege from this virus. And also, one thing I have to mention about Michigan on a whole is they're kind of ahead of some others when their enforcement strategy. That's one thing I think sets this the ETS in Michigan apart. A little bit. Their enforcement strategy has been above others and bar none compared to when it comes to enforcement. I'd like for MK to add on to Michigan a little bit on maybe some specifics or unique aspects of Michigan.
Yeah, Michigan has, since more of the beginning of this pandemic and since we have understood more about how to control this virus in workplaces, has been good on enforcement efforts and making sure that employers are taking the steps that are necessary. Their ETS just gave them a little bit of the enforcement mechanisms that they really need. And it has the basic frameworks of a programmatic standard, which is what is necessary for COVID-19. And it really requires employers to identify the COVID-19 hazards and risks in their workplace, and then create a plan and implement that plan in their workplace, and then also to train their workers on the hazards and what they're doing to protect them in the workplace, and then how to work safely themselves. Those are really key components to ensuring that we get through this virus and don't have further workplace outbreaks.
Right, very, very insightful. Thank you, MK. And the next one I would like to jump in on Oregon. Now, Oregon was interesting. It had 5, 6 different iterations of it. In its beginning, it was a good backbone and a good outline to start with, but it really didn't have a whole lot of guts. And we might have been better off without a standard in Oregon the way it was put out in the beginning. But they came a long way, and with a lot of support with labor and allies, and especially locally on the ground there. The state AFL-CIO in Oregon really stepped up. In Oregon, they have these different boards that advise their OSHA program. It's a little different than Virginia, the way they're set up, and California, we'll talk about here next. What their boards, they're advisory boards, not boards like in Virginia where they codify the rules and they vote to have the rules passed. They just give advice to the state Oregon OSHA program, and it's up to the OSHA program what they do in the end. So it's a little different scenario there. They had several meetings, several virtual meetings. They had, like I said, 5 different iterations of the standard. And by the end, we got another good, strong standard to protect workers in the state of Oregon. One thing I'd be remiss if I didn't talk about, though, is one thing that we were not happy in the end. It's not that big a deal, but it could be. Is they still allow face shields for what we call source control. You've heard about wearing a mask and wearing other protective products on people's faces to protect them from this virus, sometimes even a respirator, depending on the risk level. But they do allow for face shields to be used as source control, just like a mask or respirator. And I just don't think that's really appropriate. So I would advise to wear a mask and a face shield. But that is one of the things in there that's different from this standard, that's different from the rest of the other 3. But they did have some really good parts in this rule as well. They have some really strict physical distancing requirements. They do require mask wearing and or face shields and respirators when it fits the risk profile. They have enhanced sanitation measured. They require increased communication of safety protocols, posting of signage, and a good, strong language on incident response. And now, again, I'll ask MK, would you like to add on the Oregon ATS?
Sure. Oregon, it took a long time to get to the process, but the end result is a standard that is going to protect workers in Oregon. It was actually just issued officially this week, which is exciting to get it out and get it in effect in workplaces. It has the same basic tenets that I spelled out about Michigan, of ensuring that employers are going to have to identify and then control the hazards, and has some training provisions in it as well. I really commend the labor movement out there in Oregon, because they stuck with the long process. Rulemaking is not always a fun process, and it can be lengthy even in an emergency situation. And they really stuck with it and made sure that workers in Oregon got the protections that they deserve.
Thank you. And then, as far as specific states, we're going to end with Cal OSHA, the 4th, as of now, the 4th standard that's now in effect, or going to be in effect in the near future, that's been passed. Cal OSHA is typically unique when it comes to OSHA world. They're usually very progressive and out front on a lot of rules. For example, Cal OSHA has a heat illness standard that nobody else has in the country. So they've really taken that role as a state program forward and over a history of time when it comes to OSHA protections. And they're no different, because what's unique to California OSHA when it comes to infectious diseases is they already had in place what's known as the ATD standard, or aerosol transmissible diseases, which is, COVID-19 is an aerosol transmissible disease, so it would fit that standard. Now, that standard only applied to healthcare workers, which is very important for healthcare workers, but it didn't really necessarily apply to like construction workers or other workers in general industry, or the work with the public. I would say that it did cover some other emergency response people, but it really focused on healthcare workers, emergency responders, and some other unique job classifications. It really didn't cover workers as a whole. So that's why it's so important that, in addition to their already existing ATD standard, that they just recently passed ETS in California. that will cover all the rest of the workers. So it will cover people that are already covered under the ATD standard and cover the rest of the workforce, like in construction, like we represent, and heavy highway and other work conditions out there. So this new standard, will also address meat packing, manufacturing, and it's really, quite frankly, it just happened, but I've gotten a chance to review it, and it's a very strong standard. We're very happy with how this standard ended up. It's got a lot of the parts of the previous standards we talked about with Virginia, Michigan, and Oregon, and maybe even some stricter and some stronger worker protections than even those other three. So we're really proud of this standard, and we're hoping that it protects workers in the state of California. Now, again, I'll ask MK to jump in here and talk about the state of California's program.
One element of the California ETS that is different, but I think is also a very smart approach to this virus and this pandemic and the way that we're seeing outbreaks occur in workplaces, is that it has basic requirements for everyone. But instead of taking it in a risk category way, like Virginia did, which was also a good approach, is it has further requirements that are triggered when there's a workplace outbreak. So certain requirements for testing, which we haven't seen in any other standard, are triggered when a workplace outbreak happens. And then the employer also has to assess the program that they've set up to help protect workers from COVID-19 of like, okay, there's an outbreak here, this is not working. What further control measures do we need to take? Or how do we modify what we're doing in order to stop and slow this outbreak? Another thing that's really fantastic and so key to protecting workers from COVID-19 and to stopping outbreaks or preventing them from occurring is not having workers in the workplace who are positive or symptomatic or have been exposed and might be positive. Making sure that those workers are not in the workplace, potentially exposing their coworkers or the public if they work with them, is so important. And making sure that those workers don't have to choose either between a paycheck and taking care of their families and their livelihood and having to go into work and expose other people and prolong this pandemic.
Thank you. Very well said, MK. And bear with me for a second here. I'm going to share a slide that should be up on your screen. MK, do you see that?
I do.
Yeah, a very nice slide here. And I'm going to go in presentation mode here. So what I want to talk about here, and the reason I'm showing this slide with MK and I talking is kind of like the backbone of any health and safety protections when it comes down to worker health and safety, is what we know as, and near and dear to our hearts, is the hierarchy of controls. This is basically how safety and health practitioners approach hazards on the job and try to prevent workers from being exposed to them. If they can't prevent the exposures, they try to mitigate or lessen the blow. And that's just the case here when it comes to controlling or mitigating COVID-19. We're all under this threat of this major, major pandemic. And this is a systematic approach that everybody should be taking to mitigate COVID-19. And there's some nice examples here of the hierarchy of controls in this graphic that is from our friends with the Canadians, based on the hierarchy of controls. And the hierarchy of controls, just let me go down through them. It is a hierarchy, so they should be done in order of most effective to least effective, from elimination to substitution, then engineering controls, administrative controls, and PPE. And, this is unique when it comes to COVID-19 and infectious diseases. Facial coverings are mandated and required, but they are not recognized as PPE because they don't offer the level of protections that, say, a respirator would offer. So people might lump in face coverings and masks with other types of PPE like respirators and face shields and gowns, but they just are not recognized as PPE. But they are an important public health measure for source control when it comes to infectious disease control. So that's why they're so important. That they're so important piece of the pie when it comes to mitigating COVID-19 and its spread. So by all means, wear your mask, wear your face coverings, whatever you want to call them. They've got a bunch of different names now, but they are not recognized PPE and they are not really part of the hierarchy of controls. But we'd be remiss if we didn't mention them here. So some specific things that I want to jump in on at the top of the hierarchy. Obviously, if we can eliminate the exposures, that's the first and foremost thing we can do. That can be done easily in healthcare settings, not as easy in like construction and or public areas or manufacturing, but elimination can be isolating patients that are infected from other patients. On a construction site, if somebody shows up in a screening process with signs and symptoms, get them away from the other workers and get them medical care right away. That's a way of isolating or eliminating. Substitution, when it comes down to substitution, there's really not a whole lot of substitution out there when it comes to COVID-19. Now, when we jump in on engineering controls, this is very important. And especially as we are getting colder across the country, different depending on your geography, it's getting colder and colder out there. And as more people go to work inside to seek warmth, even in construction, I think we've been very lucky that we have natural ventilation and outside air when it comes to controlling COVID. But a lot of our work is going to go inside. So there's a big concern now about higher exposures with indoors, especially if there's not proper ventilation. So the reason I bring up ventilation so strongly right now is so we think that's the key to preventing the further spread of this in the future when we go indoors. And that's an engineering control. That is probably the most tried and true engineering control. And when it comes down to COVID protections indoors. And we've been seeing a lot of good research coming out just recently on the effectiveness of good ventilation when it's in place. Then there's also a lot of administrative controls out there, such as keeping good hand hygiene, washing your hands, some physical distancing, social distancing, whatever you want to call it. Just all those protocols that we all keep hearing. Those are the administrative controls. Staggered work shifts. And then there's the last resort, which is personal protective equipment, which we need to rely on, unfortunately, when it comes to infectious disease. It's a very important component of protections. But I have to mention it's the last means of defense. Anytime you put on any type of PPE, that is your last means of defense from a hazard. In this case, it's very important because this virus is being being spread to people via airborne particles, via contact or touching somebody that maybe sneezed and put their hand down on a surface. It's also being direct contact by coughing, by talking, by singing, just having a conversation with somebody. If you're too close together, you can actually contract COVID that way. So this is very important. That's why PPE is so important when it comes down to protecting ourselves from the virus. And like I said, I just felt like we needed to discuss the hierarchy of controls and explain a little bit further. And here's some specific examples of hierarchy of controls for COVID-19. And then if there's anything that you'd like to add, MK.
No, I think you covered it. It is so important, the specific ones that you talked about, such as ventilation and reducing the number of people in a space, staggering shifts, staggering the work, because this is an airborne disease and we know that it spreads through the air. So those are really, really essential controls, as well as, respiratory protection against the airborne virus when that's necessary.
We're going to kind of get towards the tail end of this here soon, but this is probably one of the most important parts of this vodcast webinar. Now, taking into account every one of those state ETSs we've talked about, the CDC guidelines, the hierarchy of controls, and this is probably a tough question, but I'm going to ask you, MK, if you were to outline what we call a gold standard or a model ETS for state programs that either don't have one now, or for federal OSHA if they come out with an emergency ETS in the future, if we were to model a gold standard ETS, what would the components of that be in your opinion?
Yeah, thanks, Travis. It's a very good question, and fortunately, we have some good states who have moved forward to help us set that up, right? the key part of a programmatic standard, which allows the employer to really tailor things to their individual work site and not be too prescriptive, is this foundational aspect of identifying the COVID-19 risks in your workplace and then developing and implementing a plan to control those risks that you identify. Um, Fortunately, or maybe unfortunately, because we have been dealing with this pandemic for many months, but that means we know more about this virus than we do other novel viruses that have popped up in the past. So we know how it transmits now. We know that it transmits primarily through airborne and then also droplet and contact transmission. We know that people can spread this virus when they don't have any symptoms. And we know that they're important control measures that we discuss when talking about the hierarchy of controls to deal with those things that can be outlined in a standard that needs to be incorporated into an employer's plan. Ventilation that we discussed, distancing is important. Kind of the rule has been 6 feet. But I say that's the absolute minimum because this is an airborne, and as many feet as you can is always better. Just reducing the number of people in a space and the time that is spent around other people. Respirators can be so important, as we discussed, as well as source control. And another really important component that must be in a standard, and it's because this is what is important on the ground, on the work site, is the employer and the workers really working together to identify these hazards and create the plan. Having workers involved in that process from the very beginning is going to create a stronger, more protective plan, because workers really know their individual tasks that they're doing day in and day out and can help, say, this is where the problems are and this is how I think they should be solved. That's really key and important. Other key components of an ETS is one that California did really well, is ensuring that workers who are infected or may be infected are removed from the workplace and protected from having to make that dire decision of working or losing a paycheck. And then reporting cases. We need to know where cases are happening, where outbreaks are happening. Workers need to know when their coworker has been infected and whether or not they may or may not have been exposed so that they can take action themselves. Our state and local health departments need to know where cases are occurring in a workplace so that they can do contact tracing. And also OSHA needs to know when an outbreak is occurring in a workplace so they can go in and help and say, let's help stop and prevent this outbreak from getting worse. COVID-19 is unique because it connects the community and the workplace so closely. And the workplace is the only place where workers don't have control over their environment. They're really dependent on their employers having a plan to protect them and to make sure that they can do their work as safely as possible. So another thing that goes into that, right, is training workers on what that plan is, what the risks are for COVID-19, what actions their employer is taking to protect them, and then how they can work safely on the work site. And then just one last kind of point that I think is so important is making sure that workers are not discriminated against. If they are positive, if they've been exposed, if they raise a safety and health concern, it all works better when we can openly have conversations about what is going on, and take the appropriate actions and steps together without any retaliation.
Yeah, thank you very much for that, MK. Very well done. And that last piece you discussed is so important for our workers. And being part of the Virginia board, we really worked hard on getting that anti-retaliation language in there. And I got to commend Virginia OSHA for having it in there to start with, and we just made sure it was strong. So thank you for that. In addition to what MK just mentioned, a couple of highlights that I would like to add on a little bit is the program must be written. That may sound a little onerous to some small contractors out there, but you need to have a written program so people know prescriptively what to follow, what the expectations are. You should also have somebody on your job sites assigned as either a COVID safety officer, administrator, whatever you want to call them. Somebody should have that responsibility of implementing this program on the ground at the work site. The risk assessment you've heard us mention, every one of these ETSs that exist are based on a risk assessment, which creates that availability of a programmatic standard. This virus, as the science changes, as things change with risk levels, we need to be able to be agile out there when it comes to worker protection. So that's why risk assessment is so important when it comes to things like a COVID virus. So being able to work up and down those different risk levels and categories and have the appropriate controls in place. Another very important component of a program will be screening of your workers. We talked about it throughout this vodcast, but screening of your workers on the work site before they get to work, having them self-report, having a screening process in place, and then what to do if you do pop up either positive cases and or have symptoms is very important, part of the preparedness and response plan. And then the last thing that I would add, just very strongly, lead into my next question, is you need to have prescriptive language in your programs that have required use of masks, face coverings, whatever you want to call them, and respirators and other PPE where it's appropriate based on their risk levels. This is very important. Without clear-cut definitions and clear-cut rules to follow, people kind of do what they want, and that just isn't safe out there. All right, so bringing it home here in the last couple questions, this next question might seem a little simple compared to all the details we've just discussed. But MK, I'd like to ask you, ETSs are at the state level. We don't have a federal ETS yet. What do you think of the Biden administration coming out with a national mandate to require facial coverings, respirators when needed, and physical distance along with hygiene facilities where appropriate?
The Biden administration has said that they're committed to doing an emergency temporary standard. And we really hope that they can issue a standard that is comprehensive, that takes all these components that we talked about that are so important to prevent outbreaks in workplaces and to protect our communities. And all of those elements that you said are very important to slowing and then eventually helping us move forward past this pandemic. It's going to make sure that our work sites can continue operating and that we can continue thriving while also staying safe.
All right. Thank you very much for your time today. Thank you, everybody, for joining. And in conclusion, I just say pay attention to what's going on in your individual state levels. There's a lot of information out there. It can be confusing. Hopefully, I think you could get the tone here where we're hoping for an emergency ETS for COVID-19 in the future from the top, from federal OSHA, and then we won't have to worry about individual states. Individual states can do what they want and go a little further if they like. But hopefully, we're looking for that. And just stay safe out there. Thank you. Thank you very much.